Hello, my name is Symone Franklin, and I am a DNP student with Maryville University. Today, I will be presenting my scholarly project titled Decreasing Readmission Rates with Pre- and Post-Discharge Education Sessions. My committee members for my project are my DNP chair, Dr. Gordon West, and Ron Franklin, who is the Director of Nursing at the project site. All of my committee members were very helpful with helping me gather and follow through with my project information. Background and significance. It is noted that approximately $17.4 billion in costs occur annually due to readmissions in the United States healthcare system, with around 7 million people having had either a total hip or knee replacement. Patients discharged after total hip and knee replacements are at risk for readmissions due to complications that occur after discharge. Readmission rates create barriers for not only the patients and their families, but also the facilities because of state penalty fees if patients are readmitted. Prior to this intervention, no consistent processes were in place to address discharge education sessions. Each nurse provided discharge patient education sessions at their own discretion on a case-by-case basis. This DNP project aimed to identify if providing pre- and post-discharge education intervention would decrease readmission rates amongst patients status post-total hip and knee replacements in a skilled nursing facility. Review of literature. For the review of literature, the articles that were reviewed were categorized into the following three themes, which were patient education, interventions, and callback programs. These themes were chosen because they go hand in hand with the scholarly project's purpose. The purpose of the research was to find the support and evidence-based information from the DNP project policy for decreasing readmission rates by providing patient education outreaches once discharged from a total knee or hip replacement. For the patient education section, it is noted yearly that the Centers for Medicare and Medicaid Services spend approximately $16 billion on readmissions, estimating that $12 billion of the readmission costs are preventable. With patients starting to experience shorter lengths of stay, this can negatively contribute to the misunderstanding of discharge instructions and increase the risk for adverse events after discharge. Delmore and colleagues explain patient education as the shift of health-related knowledge and skills from a healthcare professional to a patient. They continue to express that this is an important element in many health promotions and disease management programs. For the intervention section, for decreasing readmission rates amongst hip and knee replacement patients, there is no golden standard at this time. Literature pertaining to reducing readmissions include various interventions. The most studied interventions reported were interventions such as assessing the patient's readiness for discharge, ensuring follow-up appointments are carried out, providing medication education, and providing specific patient education for disease processes and procedures. Green and colleagues expressed that patient education must be customized to the patient's specific disease processes and needs, as well as it consists of plain language that is understood by the patient and the caregivers. For the callback section, to help combat the climbing readmission rates, callback systems have also been developed to address these devastating rates. The literature demonstrates that follow-ups via telephone post-discharge have become effective in decreasing readmission events. These authors continue to express that telephone outreaches educations consist of education targeted around pain management, follow-up appointments, medication use, and side effects were effective for decreasing readmissions. Studies that utilize nurses as the primary staff to outreach to the patients helped with the patient's compliance. By the nurses performing the discharge follow-up phone calls, the nurses were more familiarized with the specific patients. This allowed for the nurses to assist the patients for specific disease processes and procedure questions, as well as made the patients more comfortable with a familiar staff member. The theoretical framework that most represented this project was the Dorotheus Orum's The Self-Care Theory in Nursing. This grand nursing theory focuses on three categories that include theory of self-care, theory of self-care defects, and theory of nursing system. The first category is self-care. Self-care is a learned behavior which involves the day-to-day living of individuals. In this project, this was assessed while the patients were inpatient. They were assessed for their ability to perform self-care and the importance of the behavior. The second category of the theory is the self-care defects. In many cases, this is when the nurses are needed to bring in their expertise. In this stage, this is a defect or a broken link in the chain of self-care. Orm expresses nursing is required when an individual is incapable or limited in the provision of effective self-care. For this DNP project, this steps is when the patient must undergo a total hip or knee replacement. During this step, the nursing staff steps in and assists the patients pre and post operation to help them regain strength and help educate them about their disease processes. The third and last category is the theory of nursing systems. In this stage, the patient's self-care needs will be met by the patient, nurse, or both. In this category, it is assessed if the nursing agency is able to meet the needs of the patient's self-care demands or if both the agency and the patients meet these needs together. For this project, this is where the patients may be at the point of discharge, where they are able to perform basic needs and are stable enough to be discharged home. On the other hand, the study of performing follow-up discharge outreaches will continue to assess the patients once discharged and making sure they have a smooth transition home and is educating them if self-care defects continue. This project for methods. This project data used was a mixed method of quantitative and qualitative methods to collect and analyze the information. The participants were engaged and a prospective review of charts were utilized for this project. Electronic medical records from the skilled nursing facility was utilized for data collection and the participants were also interviewed. The minimum necessary data was collected and recorded to protect the patient's privacy. The methods of data collection include a review of records, observation, interview, surveys, and questionnaires. The review of records was to assess the patient's current diagnosis, so that education was steered towards the appropriate patient education. The observations assessed during the patient education, which was if the patient seemed to be acknowledging and comprehending the information provided to them. The interviews occurred once the patient was discharged to assess if they were taking correct medications and if they are following up with their providers. The surveys and questionnaires consisted of assessing how the patients felt the education was provided to them and assessing the patient's readiness in learning the information. Sample. The participants consisted of both male and female patients that were 18 years and older at a skilled nursing facility who have underwent total knee and hip replacements. The sample population produced 12 participants, 12 in the pre-intervention and 12 in the post-intervention. The ethnic background of the population identified for the project consisted of 33% Caucasians, 25% African Americans, and 42% Hispanics. The gender of the population identified for the project consisted of 33% males and 67% females. Data analysis. The statistical program that was used was the IBM SPSS. The Z-test was performed for the difference of two participant populations. This was by comparing the pre-intervention discharge education sessions to the post-intervention discharge education sessions. Results. The lower tail Z-test was used to determine if there is a statistically significant difference between the pre-discharge and post-discharge interventions to decrease readmissions compared to pre-intervention readmission rates before the interventions. For this study, the degree of variability was calculated with the power analysis to evaluate the strength of the results. The error power of probability 1 negative is 0.2142188. This study was deemed low in strength because the p-value of 0.214 is more significant than the significance level of 0.05. Therefore, there is not significant information to suggest a decrease in the ratio from pre to post intervention. Limitations. Limitations within this study did exist. During the COVID-19 pandemic, there was a decrease in total knee and hip replacement surgeries, as well as short-term admissions to skilled nursing facilities. This uncontrollable limitation had affected the results of the quality improvement study, causing a limitation to the population. Discussion. The results could be sustained if the project was completed again. The results could be supported again if similar inclusion and exclusion criteria were implemented during a comparable follow-up period. One approach is for the nursing staff to perform pre-discharge specific and post-discharge specific patient education. The critical element to the sustainability of this scholarly project is the nursing staff providing their education sessions pre and post discharge. Implications for practice. While this study did not demonstrate statistical significance, there are still implications for clinical practice that can be identified. Data from other studies indicate a potential for significant results when the studies are well structured. Ultimately, patients will benefit from pre and post discharge education sessions implemented as it was developed with evidence-based guidelines in mind. Further research should be conducted with a larger participant population and expand the participants' inclusion, such as not just for patients status post total hip and knee replacements, but for all discharging patients. This researcher recommends broadening the criteria to all discharge patients and a policy that will establish reimbursement for facilities to hire nurses to provide additional education and follow-up with the patients. Conclusions. While the rise of readmissions in the world continues, it is essential to provide patients with necessary knowledge in order to help make educational interventions more quality effective. Readmission status post total knee and hip replacements can be a difficult situation for patients and can cause increase in costs for both the patients and the skilled nursing facilities. The pre and post discharge education intervention can improve patient outcomes tremendously. While providing pre and post education interventions did not cause a statistically significant increase and decrease in readmission rates for this study, given improvements in sample size, there is a potential for decreasing readmissions with education. What would be done differently for this project if it was replicated would be a larger sample size and broaden the criteria for all patients. I would like to say that the Maryville University DNP program has made a great difference in my knowledge of concepts and research. I have learned how to think and expand on a higher educational level, and I am very thankful for that. I look forward to any questions or feedback from you. Thank you, and here are my references.